Hello, my name is Dr. Max Greenlee. I'm a clinical pharmacist, and today we're going to be going over a medication called Doxycycline. And you're going to learn everything you need to know to maximize your medication, along with some things to look out for, including some pharmacist pro tips at the end. Before we get going, if you have any other medication that you want a full review on, please just let me know in the comments below, and I'll add them to this series of how to maximize your medication. What is Doxycycline? Doxycycline is a tetracycline antibiotic that fights bacteria in the body. Doxycycline is used to treat many different bacterial infections such as acne, urinary tract infections, intestinal infections, respiratory infections, eye infections, gonorrhea, chlamydia, syphilis, gum disease, and many other types of infections. US brand names include Vibromycin, the most common, Acticlate, Doxy, Doxycycline, Aracia, Periostat, and many others. Most likely you're going to end up with a generic. What dosage forms does doxycycline come in? Doxycycline comes in tablets, liquid, capsules, and IV formulations. How does doxycycline work? Doxycycline goes inside the bacterial cell and makes it so the bacteria cannot make the proteins that it needs to continue to be living. And it also can damage the cell membrane. This only works for susceptible bacteria, but many bacteria are susceptible to doxycycline, and that's why it works so well. How long till my medication starts to work? Whether you get doxycycline administered in the hospital, in your IV, or you take the medication by mouth, the concentration of doxycycline in your blood ends up being about the same. After taking doxycycline, it usually takes about 3 hours to have a high enough dose in your system to start crippling the bacteria that your body's fighting. However, most people taking doxycycline will need about 2 days before they first start feeling better. But even though you may start feeling better after just a couple days, it is extremely important to continue to take the doxycycline until your bottle is empty and you're taking the entire course of prescribed therapy. By taking doxycycline this way, you will ensure that all the dangerous bacteria are killed and there are none lingering around to mount a second attack. And after taking doxycycline, your body gets rid of it and you're peeing your poo. What makes doxycycline awesome? One of the things that makes doxycycline absolutely amazing is that doxycycline can treat many common bacteria. And it also can treat a whole bunch of extremely uncommon bacteria that many other antibiotics can't treat. Doxycycline can treat infections in your respiratory tract, your sinus passages, on your skin, your urinary tract, along with treating many STDs. Doxycycline can even treat tick-borne infections such as Rocky Mountain spotted fever. And that list is by no means all-inclusive. I mean, doxycycline is even used commonly to treat acne, which can be caused by several common bacteria that live on your skin. What are the downsides of taking doxycycline? If you are between the age of 18 and 60, take no other medication, or have no other medical conditions, side effects you're more likely to experience include headache, nausea, upset stomach, joint pain, sinus congestion, or a rash. One of the more interesting downsides of doxycycline is its ability to affect bone. Doxycycline can stop the bone of fetus and children under 8 years of age from forming and developing normally. The main consequence of this is a yellowish gray-brown stain on the teeth of children that use the medication before 8 years of age, or if their mother used it while they're in late stages of pregnancy. Doxycycline also can increase the chance of getting a yeast infection in some patients. Doxycycline may make your skin more sensitive to sunlight, giving you a better chance of getting an unpleasant sunburn. Unpleasant may be an understatement, a horrible sunburn. Who should never take doxycycline? You should not take doxycycline if you've ever had an allergic reaction to any of the tetracycline antibiotics. Those include tetracycline, oxytetracycline, doxycycline, or minocycline. As with any new medication, or new food for that matter, watch out for signs of an allergic reaction, like rash, hives, itching, red, swollen, blistered, or peeling skin, with or without a fever, wheezing, tightness in the chest or throat, trouble breathing, trouble swallowing, or when you're talking, having unusual hoarseness or swelling in the mouth, face, lips, tongues, or throat. If you experience any of the side effects, stop taking the medication immediately and reach out for help, because things can get worse rather quickly. Also, stop taking the medication and reach out to your doctor if you start experiencing signs of liver issues such as Coca-Cola colored urine, yellowing of the skin or eyes, and light colored poops. Also call your doctor right away if you have a headache or eyesight problems like blurred eyesight, seeing double, or loss of eyesight. What are the most common interactions I should look out for? Medicines that interact with doxycycline may either decrease its effect, affect how long it works for, increase side effects, or have less of an effect when taken with doxycycline. And as always, remember, an interaction between two medications doesn't always mean that you must stop taking either one of the medications. However, sometimes it does. Speak to your doctor or pharmacist about how drug interactions should be managed. Common medications that may interact with doxycycline include antacids such as aluminum hydroxide, calcium carbonate, magnesium hydroxide, or sodium bicarbonate, which may affect the absorption of doxycycline, so pay attention to those. Anticonvulsants such as phenytoin or phenobarbital. Also stay away from bismuth salicylate or Pepto-Bismol, multivitamins, calcium and iron supplements. Also, it's important to understand that doxycycline may cause your estrogen-containing birth control not to work. So while taking doxycycline, make sure and practice an alternative form of birth control. And of course, as you know, these aren't all the possible interactions, but these are some that I think that you should most definitely know about. So is doxycycline a good medication? What's the bottom line? So doxycycline overall is a great medication. There are a lot of factors that you have to account for when taking this medication, but there are many cases where it's a cheap and effective medication that doesn't have a better alternative, especially for the price. So overall, stay away from this medication if you're pregnant or trying to become pregnant, have an allergy to it, or are under 8 years of age. Okay, there are some common questions and concerns with doxycycline that I know you'll have at some point in time. I wanted to give you some pharmacist pro tips before we wrap things up, so this will allow you to maximize your medication. Okay, your first pharmacist pro tip is to make sure and stay hydrated while taking doxycycline. A lot of people over time I've found get an upset stomach associated with taking doxycycline, but this common side effect can be minimized as long as you stay completely hydrated. Also take the medication as prescribed and for as long as prescribed until instructed otherwise by your doctor, because some things that doxycycline is used to treat can require an extremely long time to cure. So just because you're feeling better, it doesn't mean you should stop taking the medication if your doctor thinks that you should continue taking it. Also try and minimize sun exposure as much as you can while taking doxycycline, and when you do decide to go into the sun, cover up as much as possible. And also grab some 50 SPF sunblock. Trust me, your skin will thank you for it. Thank you so much for stopping past the channel. I hope this information helps you maximize your doxycycline. If you want to learn more about other medications you're taking, put them in the comments below. And I'll make a video on how to maximize those medications also and add it to this playlist. I put out new videos every week, so hit that subscribe button to stay up to date. Until next time, stay healthy, stay happy, and stay curious. And as always, have a beautiful day.